So my name is Dr. Daniel Lucey, Dartmouth class of 77, and I'm very pleased and honored to be able to deliver this final final lecture in Professor Benjamin's course on epidemics. Professor Benjamin asked me to focus on the ongoing first wave of the SARS coronavirus 2 COVID-19 pandemic. I think context is always very important, as you've learned throughout this course. We've studied major human pandemics and epidemics over many years. So I'd like to list some of the major pandemics in humans that we know of that have preceded the current one, which is the COVID-19, the coronavirus pneumonia pandemic, the first of its kind ever. So of course, smallpox was a scourge of our species for thousands of years, and it's the only human disease, infectious disease, that's now been eradicated by a declaration by the World Health Organization in May of 1980. Plague, caused by a bacteria that you studied in this course, has caused multiple epidemics and pandemics, and it still exists in some areas today, in Madagascar, in the Congo, even in the Four Corners area in New Mexico, Colorado, parts of the United States. Cholera, due to a bacteria, has also caused multiple pandemics over the centuries, and as we all know, it still does exist in some areas in the world today, including Haiti, for example, and Congo and elsewhere. The pandemic of most prominence in my professional career as an infectious disease physician is HIV/AIDS. I was an intern after finishing medical school at Dartmouth in 1982, went out to San Francisco. It was before the HIV virus was discovered, but long after the HIV virus had discovered us, humans. And so there are many patients with AIDS in different parts of the world, but it was unrecognized as a new syndrome. So the virus probably jumped species from animals to humans about a little bit over 100 years ago in Cameroon or Kinshasa in what's now the Congo, DR Congo. But the virus itself, HIV, was only discovered in 1983. And of course, influenza is the pandemic we're most familiar with. And in the past 100 years, there have been these four major influenza pandemics that I've listed here, with the one from 1918 to 1920 being by far the worst, and each of the next three being less bad by far, including the one a decade ago, 2009-2010, which began in Mexico and was soon thereafter recognized in the United States. And lastly, I always include what people like to call disease X. I tend to call it disease X plus Y, because I think we should always be anticipating at least two or more, not just one new severe epidemic or pandemic. But some examples of disease X, even to this day, what the cause was of the plague of Athens during the war between Sparta, several wars between Sparta and Athens. We still don't know what the actual microbiological cause of that plague of Athens was, so it's a disease X. COVID-19, before the SARS coronavirus 2 that causes COVID-19 was discovered in early January of this year in Wuhan, China, in the province of Hubei province. To today, as it spreads around the world, it's quite possible to what's next, which is the question I always get when I give talks at Georgetown University or elsewhere. What's next is already here, but we just haven't recognized it yet. That's my operating professional modus operandi, if you will. So what's next is quite possibly already started, but we haven't recognized it yet. And that's true for most infectious disease epidemics. By the time it's recognized, because it's caused so much illness or death, it's already been spreading for some number of weeks or months, or in the case of HIV, for many decades, perhaps close to a century. Again, in terms of context for COVID-19, the current pandemic due to the coronavirus, SARS coronavirus 2, I think it's important to think about the phrase, what is past is prologue. It's inscribed in one of the statues outside of the National Archives here in Washington, D.C., near the mall. And so I've been very fortunate to be able to go to work overseas every year since 2003, when I went to China and to Hong Kong and then to Toronto, Canada, to work during the first SARS coronavirus epidemic. It was not a pandemic, fortunately. It didn't spread into the Southern Hemisphere. There are no Americans that died of SARS in 2003. But I was very fortunate to be able to work in a hospital in Scarborough General Hospital in Toronto, one of the SARS designated hospitals in 2003. And on the weekends, I had to, we call moonlight or do a little extra work in the intensive care unit, which means I had to get dressed up in this personal protective equipment that you can see here. And where past is prologue, or what you learn from past epidemics help you to prepare for future epidemics. I show the picture on the right side of your screen from working with Doctors Without Borders and Médecins Sans Frontières, MSF, during the Ebola epidemic in West Africa in 2014. This picture is from Monrovia in Liberia. Before that, I worked with a different non-governmental organization in Sierra Leone and Freetown in August. And again, as I mentioned, before going to Toronto to work for SARS, against SARS, I went to Hong Kong on the left side of your screen, and then to the mainland of China, to Guangdong province in the southeast of China, which is where the SARS virus started in, we think, in November of 2002. In Hong Kong, I was very impressed that there's really a very strong culture of safety against the virus, to be protected against the virus. So here, everyone, this is myself with two friends from Hong Kong, and we all wore masks everywhere that we went. And that was certainly the case when I returned this past February to China. This is a picture of the other coronavirus pneumonia epidemic. It's called the Middle East Respiratory Syndrome, or MERS, M-E-R-S. And this is a picture from the Middle East, from Doha, the capital of Qatar, Hamad General Hospital, where I went to work with some Qatari colleagues in April and May and June and September of 2013. Putting it all together in terms of past epidemics from history, and also ones that I participated in all these years, from HIV in '82 to plague in Madagascar in 2017, and now of course there's a new one, but which is COVID, which is a pandemic. But in 2014, on the way to go to Sierra Leone and then to Liberia, I went to the Smithsonian Museum of Natural History, where fortunately one of my graduate students from Georgetown had arranged a meeting where I could talk with two people who were in charge of hearing proposals for new exhibits at the Museum of Natural History. So I proposed to have a big exhibit on epidemics. Again, this is August of 2014. And initially it wasn't perceived as a very good idea, because the Museum of Natural History, of course, has many things, including dinosaurs and diamonds, the Hope Diamond, and gemstones, and a huge anthropology section and exhibitions on oceans. But as the Ebola epidemic continued, and then the Zika congenital syndrome epidemic began, the administration of the Smithsonian Museum of Natural History very kindly said, well, if you can help raise several $1 million for the exhibit, then you can give it a go, and invite friends from around the world and from the United States, et cetera. And we all worked together, and the exhibit opened in May of 2018. Of course, it's closed now because of the pandemic of COVID, but it'll reopen and be open at least through the end of 2021. And I hope it's extended to include COVID and perhaps become a permanent exhibit, but that's just wishful thinking on my part. So to get back to the specific pandemic now, the coronavirus is a family of viruses that is named after sort of the appearance of the sun, if you will, under electron microscopy. So there are 3 coronaviruses in humans that cause pneumonia. There are others that cause a cold, but these cause lower respiratory infection and pneumonia. And I've mentioned them already. The first one is the severe acute respiratory syndrome, or SARS, from 2002, we think started in Southeast China in Guangdong province. And then the Middle East Respiratory Syndrome, or MERS, which was first recognized in 2012 in a hospital in northern Jordan, in Zarqa, Jordan. But the great majority of patients, including several months after the first outbreak was recognized, although mostly retrospectively in Jordan, was the outbreaks began in Saudi Arabia, or they were first recognized in Saudi Arabia. And so the great majority of patients with MERS have come from the Arabian Peninsula, and particularly Saudi Arabia. And now we have the third coronavirus pneumonia. But unlike the first 2 that didn't cause a global pandemic, COVID-19 obviously has caused a pandemic. So it's in almost every country in the world, the Northern Hemisphere, the Southern Hemisphere, the East and the West. And again, just to define the terms, the virus is called the SARS coronavirus 2 because it's genetically similar, but not at all identical, but similar to SARS virus that caused the outbreak in 2002, 2003. And the disease that SARS coronavirus 2 causes is called COVID-19. And to the best of our knowledge as of today, the origin of this virus is in China, most likely in or near the city of Wuhan, which is the capital of the province of Hubei, H-U-B-E-I. So it's different than the Guangdong province where SARS started in 2002. In terms of commonalities, all three of these coronavirus pneumonias are found, well, we think that they originated, I should say, in animals and spread person to person through the air, through physical contact, by touch. If the virus is on your hands and you touch your nose, your eyes, you can get infected that way. But I do want to emphasize that we still don't know what animal or animals the SARS coronavirus 2 originated in. There's theories, maybe it came from bats, maybe it came from pangolins, maybe it came from some mixture between bat coronaviruses and penguin coronaviruses, and maybe some other animal contributed yet a third coronavirus, and they mixed and what we call recombined and out of that was created the SARS coronavirus 2, presumably somewhere in nature. In my opinion, this is naturally occurring. It's not a leak from a laboratory or a laboratory action, and it's certainly not a bioterrorism or biowarfare agent. So again, COVID is the only one that's caused a global epidemic and what's generally defined as a pandemic. So in terms of where is Wuhan and Hubei, I'm sure you know, but this is the map of China, and sort of the orange tangerine color is Hubei province, and Wuhan is in white, and that's the capital with the red dot there. That's Wuhan right there. And we think that that's the origin of SARS coronavirus 2, which then led to the ongoing global pandemic of COVID-19. It was in the last week of December in Wuhan, when there's a young physician, an eye doctor, an ophthalmologist, Dr. Li Wenjiang, who began sending tweets on the Chinese equivalent of Twitter, Weibo, sending tweets to a small number of his former medical school classmates and other physician colleagues, warning them that he thought that there was a new SARS-like contagious pneumonia, or possibly it was the old SARS pneumonia virus that had come back or maybe mutated. But again, I'd like to emphasize that this was in December, and he was only one of at least eight other medical or public health personnel or individuals who also sent out messages. They were very concerned that there's a new SARS-like pneumonia in Wuhan. Unfortunately, he and the others were brought into police stations and disciplined and told that they had to sign a confession that they were passing messages or information that was not true, and that they had to agree to stop doing it. And he did. He's a young man. He has a wife who is pregnant. He has a 5-year-old child, 2 elderly parents who are ill, and he went back to work in a hospital in Wuhan. And most unfortunately, he got infected with this, turned out to be SARS coronavirus 2, a new virus, exactly what he was warning people about in December, before the virus was discovered in early January. And he died on February 6th here in the United States in the afternoon, which would have been February 7th in the morning in China. So many people around the world, myself included, consider Dr. Li Wenjiang a hero, one among many, and he paid the ultimate price for speaking truth to power. The question to this day still persists and has not been answered definitively. That is, when and where was the origin of COVID-19 or the SARS coronavirus 2? Initially, Chinese authorities said that it was from a specific seafood and live animal market in Wuhan, of which there are many, and many in Hubei province and many in Guangdong province and throughout China, especially in southern part of China. And there are some in other parts of the world, in Vietnam, for example, even in the United States in some places, New York City, for example. But to this day, we're still not sure what is the actual origin, location, or time when the SARS coronavirus 2 that caused the pandemic that we're living in now, COVID-19, began. On January 25th, I published something on the Infectious Disease Society of America, or IDSA website. It's called Under Science Speaks, where basically I proposed that the source was not the market, the seafood market, and it didn't begin in December, it began earlier, perhaps September, October, or certainly by November. And an investigative journalist named John Cohen from Science magazine interviewed me, called me up Sunday morning, the next day, January 26th, wrote an article that he then posted online in Science that evening, Sunday, January 26th. And then it went around the world. He didn't tell me he's going to publish it that night. So I woke up in the morning, I had over 25 emails from around the world asking, what do you want to be interviewed? And a lot of other questions that weren't so pleasant about why I had taken this position. But for me, the position was clear. It was the truthful position. That is that the data argued against the seafood market being the source. And I'd just like to emphasize that the Director General of the China Centers for Disease Control, or China CDC in Beijing, Dr. George Fu Gao, G-A-O, he was quoted May 23rd, about 10 days ago, in the South China Morning Post newspaper in Hong Kong. And I contacted him to be sure he was quoted correctly, and he assured me that he was. And he said that we, China that is, no longer believes that this virus and this pandemic started in the Wuhan seafood market. So I was very glad to hear that. So I asked him one of the questions, well, what's the evidence now? Why have you changed your position as far as the source of the virus? And he said, at this time, I can't share any more evidence or information, but we no longer think it's the seafood market in Wuhan. So I think that there's going to be some very exciting news out of China very, very soon. And I don't know any inside information, but I think it's going to be shared with the world very soon as far as what the origin of this pandemic is from the point of view of the China CDC and the Chinese government. So where are we today, June 2nd, 2020, in terms of the COVID pandemic? In terms of global spread, unemployment, potential treatments or preventions, and vaccines. So worldwide, there's over 6 million laboratory confirmed patients. Medical people only say cases, but they're human beings, just like Dr. Li Wenjiang, and over 375,000 deaths. And I really want to emphasize that these are laboratory confirmed. So there are many, many times more patients who have been infected and who have died. But for various reasons, they haven't had a laboratory test done, or the laboratory test was falsely negative, even though they had the infection. And so the numbers are much higher than what we know of by using the criteria of laboratory confirmation. So in the United States, there's been over 1.8 million laboratory confirmed infections and over 105,000 deaths. In China, there's been approximately 85,000 persons infected, so-called cases, and less than 5,000 deaths. So many, many fewer cases and deaths than in the United States. In fact, in the United States, there's many more laboratory confirmed patients and people who have died of COVID-19 than anywhere else in the world by far, whether in Europe, in the UK, or Italy, or Spain, which were three of the countries hardest hit in Europe, or in Iran, or elsewhere in the Middle East, or in Russia now has many cases, fortunately not as many laboratory confirmed deaths. And now, as probably you know, as the weather turns cooler in the southern hemisphere, I think there's going to be many more cases in the Southern Hemisphere. And right now, specific cities in Brazil have been very hard hit. In Sao Paulo, for example, in Manaus, and in Southern Africa, in Cape Town, in the Republic of South Africa, and parts of Indonesia, and Jakarta, and Surabaya, and elsewhere. In the United States, I'd like to emphasize a very tragic reality, in fact, and that is that over 65,000 healthcare personnel have been confirmed by laboratory testing to have been infected with the SARS coronavirus 2 and to have COVID-19, and over 300 healthcare personnel so far have died in the United States due to this virus. And there will be more. There will be more. As we all know, each week with the new unemployment figures, as of last week, over 40 million Americans had filed for unemployment related to this pandemic. So it's not only about the virus and the medical and public health issues, but this virus and this pandemic has done to the United States economically something that really, to my knowledge, no infectious disease has done since perhaps 1918 to 1920, the pandemic of influenza. And I hate to say it, but I think that there will be even more Americans filing for unemployment this week and next week, and for some weeks to come. I hope not, but I'm afraid so. In terms of treatment, there's really only one treatment that's been shown to work, and that was in the United States. Recently, it's called remdesivir, but it's only mildly helpful, and it's only given in the vein, so it's intravenous. There's no oral form, there's no pill that can be taken, or tablet. And what it does is it helps people to recover, to get out of the hospital sooner than they otherwise would have. So that's why I say it's only mildly helpful. It didn't have any statistically significant difference or benefit in terms of survival compared to not receiving the drug. Hopefully there will be more and more effective drugs, and I think there will be, and I think they'll be used in combination with remdesivir, I believe it'll happen just like it's happened for other severe infections like HIV, like for hepatitis C, for tuberculosis, and others. But we're still in the relatively early days in that regard in terms of effective treatments for SARS coronavirus 2 and COVID-19. And in terms of vaccines, I'm sure you've heard a lot. There's never been a vaccine against this a pneumonia that causes a virus pneumonia that causes that's due to a coronavirus. So no vaccines for SARS in 2003, no vaccines for MERS, which is still ongoing in the Middle East mostly since 2012. SARS hasn't come back after 2003. So we have no vaccine. So it's not like influenza where we make a new influenza vaccine every year and we understand what's needed to make flu vaccines. Instead, we're still out there trying to create the first human coronavirus vaccine against a coronavirus that causes pneumonia. And in fact, we don't have vaccines against other human coronaviruses, of which there are at least 4 that basically cause a cold, an upper respiratory infection, rather than the lower respiratory infection and pneumonia that SARS and MERS and now SARS coronavirus 2 cause. So we're really on uncharted waters. There's a lot of hope. There's the phrase Operation Warp Speed that the US president has given to the effort to develop a vaccine. And there are many other vaccine candidates around the world, in China at least 5, and in Oxford in the UK, and in Germany, and in Israel and Brazil. Many places are working on vaccines. But I'm not as optimistic as others are that there'll be vaccines available for 300 million Americans by the end of this year. I really don't think that that's likely to happen. And if it is, I am concerned about how well does it work and how thorough is the safety data that we'll have. I hope I'm wrong. Another very important issue with regard to the pandemic in the United States, in addition to the unemployment, over 440 million Americans caused by this pandemic, or largely caused by this pandemic over the past several months. As we know, there have been protests and demonstrations and people not related to the protests against the death of George Floyd in Minneapolis, who have been looting and doing other atrocious things in many parts of our country, including here in DC, a building immediately adjacent to where I live, and other places in the city, and certainly, as you are well aware from pictures from New York City and Manhattan last night and other places, Philadelphia and other places. So what I want to emphasize is that there, all 50 states have held protests where people have come out into the public, some wearing masks, some not, but without the usual physical distancing or so-called social distancing. And so, although it's June now and the weather is warmer, I am very concerned that there's going to be renewed outbreaks and epidemics within the pandemic of COVID-19 in the United States in the weeks to come. Again, I hope that's not true, but I think it's very likely. So to finish up very soon, let me just in this slide summarize what's next, in my opinion, with regard to the pandemic of COVID-19. And again, there are ongoing epidemics, or I like the term that I've made up, pan-epidemics, that are occurring around the world and even within the United States, amidst the mass unemployment, the protests, and the health infrastructure that has been weakened by this epidemic, with the worst case, I think, illustrated by what happened in New York City recently in terms of hospitals being overwhelmed by the large increase in the number of patients with the coronavirus pneumonia, some of whom, many of whom needed intensive care, and some of whom needed to be on breathing machines, on ventilators. So overall, what's next? I think it's good to be good and appropriate and importantly to recognize the need for being humble, because we really are uncertain about what's coming next with this pandemic, because it's the first ever coronavirus pneumonia pandemic. And I think that the United States didn't respond, or didn't prepare and respond in as timely or thorough, comprehensive, or sustained, or collaborative or cooperative manner that we could have and should have, and we haven't, and we didn't. In addition to the Northern Hemisphere, in the Southern Hemisphere, there's what I've termed COVID winter is coming, starting this month. So end of June through September is summertime here in the Northern Hemisphere, but in the Southern Hemisphere, of course, it's the winter time. And every winter there's an influenza, seasonal influenza epidemics in the Northern Hemisphere and the Southern Hemisphere. So what's coming in the Southern Hemisphere this month into September is what could be called the influenza plus COVID winter. So influenza alone can be quite severe. Sometimes it's more severe than others in the winter. But now we're going to have a COVID winter in addition to the typical better or worse, more or less severe influenza winter. We're going to see what happens in the Southern Hemisphere, and then it's going to come most likely, again, I hope I'm wrong, but I think we have to prepare for the likely scenario of an influenza and a COVID winter starting in December or sooner, perhaps even in October, November in the Northern Hemisphere, including in China, including in Europe, including in the United States. And this could go on for more than 1 year. It could be 2020, 2021. Some people think even longer. The key thing about COVID-19 and SARS coronavirus 2 is that it has never been seen before by humans, and so we have no immunity. Whereas we have some immunity to influenza from surviving it each year and from getting vaccinations, but there's no vaccines for any coronavirus pneumonias, and certainly not for this new one. And no one is immune. 7.7 billion people on the planet now, no one's immune. So that's why, in my opinion, this virus will continue through the warm weather of the summer now in the Northern Hemisphere in the United States because no one's immune. So I think it will go down, although I'm not sure with the recent protests and with people not practicing physical or social distancing for quite understandable reasons in terms of the protests against the death of George Floyd. But I'm afraid there's going to be more cases throughout the summer than there otherwise would have been in the United States. In terms of treatments, I alluded to earlier, I think that although there's only one intravenous treatment today, I think that there will be more drugs, oral drugs, that we can use in combination with one another and with the intravenous treatment for people who are sick enough to be in the hospital and get intravenous treatment. And also there will be antibodies against the virus, various forms, either plasma antibodies from people who have recovered and then donate their plasma with the antibodies against the SARS coronavirus to help treat people who are very sick in the hospital. It hasn't been proven to work yet for this virus, but it's been used for other viruses and diseases in the past. So very hopeful that antibodies in the plasma of people who have survived COVID-19 will be at least partially effective to help people who are very sick and to help them survive COVID-19. Vaccines I've already mentioned. I think that there will be one or more available in early 2021. I honestly believe that China will have the first and perhaps more than one candidate vaccine that they license in China. And I think that could be in China for use only in China by the end of this year, but only in specific populations that they consider high risk, perhaps healthcare workers, perhaps essential frontline workers, however that's defined in China, and perhaps for others, and I'll just leave it at that. I think that we should anticipate there are going to be major geopolitical issues with regard to COVID vaccines. What countries do they first become available in? Or to what degree will they be shared with other countries? And multiple other issues, geopolitical issues related to COVID vaccines and also COVID treatments, perhaps antibody testing or antibody treatments. I think these are all things that we really should be anticipating and planning on and working together now on, not only within the United States, but with other countries and with the World Health Organization. I hope that the president's recent decision to withdraw, last Friday he said he's going to withdraw our country from the World Health Organization. And I think that would be a mistake for very, very many reasons. I've been a critic of the World Health Organization with regard to their response or inadequately early response to the Ebola epidemic in West Africa, to the Zika epidemic in Brazil, the yellow fever epidemic in Angola and the Congo, the plague outbreak in Madagascar in 2017 where I worked, and Ebola in the Eastern Congo, 2018 and 19, and of this pandemic. So I've been critical of the WHO in public, in writing, et cetera. And I say that only to emphasize that all that said, I feel 100% in favor of continuing the United States participation in the World Health Organization. I think we need them now more than ever, and I think they need us to some extent. But certainly, we need to continue to participate actively with funding, with expertise, with sharing of information. So to finish the last 5 minutes here, just a few quick slides and a personal note. So in January 14th of this year, right after the virus had been discovered about a week earlier and shared with the world, I had been scheduled to give a talk at the United Nations in New York City at the 5th floor with two physicians who work there, who are shown in the picture on my left and right here in one of the walkways in the UN building in New York City. And the topic of the talk, I had proposed it before we knew about the epidemic. I was back in November, I proposed it, and invitations were sent out December 23rd. to about 215 email addresses, United Nations email addresses, workers around the world. And the title was Lessons from SARS for the Next Rapidly Spreading Lethal Respiratory Pandemic. Lessons from SARS coronavirus for the next rapidly spreading lethal respiratory pandemic. So then the talk I gave on January 14th about what turned out to be SARS coronavirus 2, which now is causing a rapidly spreading lethal respiratory pandemic. So I don't say this to suggest that I was prescient in any way, but rather to say that if I could see the likelihood of this, and the likelihood meaning that it's likely enough that we should be planning for it, talking about it, and organizing for a next SARS coronavirus pandemic, then many other people saw the same thing. But worldwide and in the United States, we didn't prepare at all sufficiently. And in the United States, we responded much less well, in my opinion, than did Hong Kong or Singapore or South Korea or New Zealand or a number of other countries around the world. On February 6th this year, I wrote a paper online that I think Professor Benjamin maybe has posted on Canvas for you all. It's in a journal that's called Think Global Health. It's from the Council of Foreign Relations. And I wrote it with a medical student from Georgetown, Kristen Kent. And it's titled Coronavirus, Unknown Source, Unrecognized Spread, and Pandemic Potential. Again, this was published on February 6th, so we were writing it in late January. And the pandemic wasn't declared by the World Health Organization to be a pandemic until March the 11th, so about 5 weeks later. And back then, one thing that we emphasized was that, that Africa should be prioritized. At that time, there were 0 cases reported, 0 patients with SARS coronavirus 2 or COVID in Africa, but having worked in multiple places in Africa and multiple outbreaks and multiple epidemics, I knew that Africa was not immune, but they just didn't have the laboratory testing capability. As of February 1st, there were only 2 laboratories in the entire continent, one in Senegal and one in South Africa that could perform the test. That's changed now, and now there are many laboratory confirmed cases in the continent of Africa, on the continent. And finally, I wanted to go to Wuhan on December 31st. It simply wasn't possible. So February 11th, finally, I was able to go to Hong Kong and Shanghai, and then on to Cairo in Egypt and the Middle East to try to understand on the ground what was going on with regard to the pandemic. And the picture on the left is with 3 Hong Kong infectious physicians who took care of patients in 2003 during SARS, and now they're taking care of patients with SARS coronavirus 2. And we've been friends all these years. They've invited me back almost every year since 2003 to give talks and exchange information about plague and MERS and Ebola and influenza and lots of other things. And in the mainland, I got to Shanghai hoping I could get to Wuhan from the mainland, but again, it was absolutely impossible to go there. So, so after Shanghai, I left and went to the Middle East to try to understand what was going on there with the epidemic, which then became a pandemic. So I'd like to finish the last 2 slides. This is from the final part of the Smithsonian Museum of Natural History exhibit on epidemics. We feature what's called the One Health perspective, which is the triad of human health, animal health, and environmental health. So all the epidemics in the Smithsonian exhibit I participated in a sense, in some small way, helping to fight alongside many tens of thousands of colleagues, international and national colleagues. And so at the very end, there's this question: where in the world are outbreaks occurring? This is a big plaque on the wall at the end of the exhibit at the Museum of Natural History. And some members of the Smithsonian team, anthropologists, visual designers, architects, writers, educational specialists, they put this quote that I always use when people ask me, well, what's next? And I say, what's next is already here, we just haven't recognized it yet. Again, that's how the talk started. That's how I'd like to finish and emphasize that, you know, what's next might already be out there. The next SARS coronavirus 3, or the next influenza, or the next plague, or cholera, or the next plague of Athens, disease X, or disease Y. So I'd like to stop here and thank you very much for your interest, your time, and your attention. This is my Gmail address. It's simply my name, Daniel.Lucey, L-U-C-E-Y, and then the number 8 after the Y, which probably you recognize has good associations, if you will, in China, sort of the infinity symbol on its side. So please feel free to send me comments or questions, and I wish you all the best. Stay safe, and I wish you courage. Bye-bye.